Hi, welcome back to Built Different Podcast, the DPT edition. My name is Aaron Kennedy,
My name's Kevis Perry.
and we are in person this
We in
time.
person. Yeah. They always see us at our own places, of course. So this is good. Y'all finally get to see us come together. We in lab immersion right now. So
Right.
very excited to be with my guy. I'm gonna let him go ahead.
I mean, I'm glad to be here. Absolutely. It's different here.
It is. It is. I'm sure. I've never been to Virginia before, but I'm sure Virginia is different than Tennessee. So
I mean, there's similarities. Some people.
you on the East Coast. Welcome back to Tennessee. You know what I'm saying? Even though I'm from Illinois, but I've been here in Tennessee most of my life, so
Okay.
it's I've adapted to it. So
Would you claim Tennessee as your place then?
I'm a Tennessean. I'm gonna go ahead and say it. I've been here for over 20 years, so
Y'all heard
I
it
would
here?
say I'm a Tennessean, but my heart is back home in Illinois for sure. My heart is back home for sure.
Well, I'm BA 757. Y'all know what it is.
Kind of rip mine at 815.
Oh.
I know what's up. But I'm in 615, so this is where I'm re-repping today.
Today,
man.
we
615.
we don't go back and forth for 757. We know where we're.
Fair. That's fair.
But like we always start off with our podcast episodes, we answer a couple of questions that we've gotten from our past episodes. So, Takivas, can you hit us with a question?
Of course. First question I can think of off my head that I saw, people were asking about the dynamic between the students and the faculty while we've been in lab. So I know today and this whole lab immersion, we've been in lab for about 6 days now. So, and today we had a town hall. So, and it was very emotional. A lot of people felt passionate about some things, which is completely acceptable, because we are in a program that everybody cares about, and it's you're supposed to be passionate about it. So, we had some really touchy topics today. So, I'll let you talk about a little bit of how it's been so far for you with the lab and professors as far as the student dynamic.
One thing I like about our program, having those moments where we can kind of fully reflect
Right.
and be able to communicate,
Mhm.
especially with the fact that our college, South College, is where we are. We're the first cohort, so we kind of have to be able to communicate with the faculty members so we can ensure the next group of individuals after us, could have an even greater experience than what we're having. So, to answer your question about the connection and between faculty and students, I think it's great. In my personal opinion, I've found a good mentor in one of our professors. And outside of that specific professor, I feel like I can come and ask any type of question to them, and they're extremely knowledgeable. And because we're in a hybrid program, they're also very diverse. They have such a differing backgrounds, so you get all the perspectives and feedback. It's pretty amazing when we all get into one place. You get to admire that. What about you?
Absolutely, I agree with you there. Just being able to have that dynamic, like you were talking about. Also, at the beginning, I'll say like at the beginning of the program, I was like having to feel them out to see like what their personality was because I wasn't sure how it would go. But as I've gotten to know them over the quarters, I've built relationships just like you have, and I feel like I can go to any of our professors and just have a regular conversation. If I'm curious about something, they'll explain it to me. They offer additional time set aside, like during lunches or open lab times, just to try to explain things further, to get you a better understanding. So definitely, I appreciate their dynamics and things there. So
and they're definitely open to feedback, I would say. They try their hardest to ensure like they give us a very good foundation, especially since we're so close to clinicals right now. Like we're all kind of like, I feel like as a cohort, we're all kind of just stressing a little bit about that first time that we're in. I mean, a lot of people are going to inpatient, but I know some people are going to outpatient.
Mhm.
They'll get their inpatient. We all gotta go.
Right.
But they're doing their best to prepare us, and sometimes there's no greater learning than the hands-on experience.
Absolutely.
We're here in lab immersion, so of course,
Right.
like, we're getting the hands-on. But I mean, really go learn when you get in there, right?
True. I like that, the diversity of it, because you're talking about how we get like the hands-on experience. They give us like real time how a patient will be, especially with us going through neuro right now.
Oh my
They
gosh,
give us patients who literally like spinal cord levels that are higher level patients. They have like not as much mobility and function in their body. So they're really good actors because they've already experienced those kind of patients.
hmm
So they give us the real life in time, like
Shout out to Dr. Swanson.
yeah. So
He's
really,
the best picture actor ever.
yeah, they do a great job. They do a great job with that, and they offer so much feedback on it, and it's awesome to be able to put hands on other kinds of bodies, like our other
Mhm.
classmates and things like that. So it helps us be able to get like the real experience.
Yeah.
So it prepares us well for when we do go to clinicals. And like you were talking about, a lot of people are really stressed out about it, but I feel like they're preparing us very well for it.
Mhm.
Um, and it's normal for everybody to be nervous about it. And if you go into clinicals and you don't feel prepared, don't feel like that's abnormal, because you are a student. We're all students, and we're going to continue to be students even when we do graduate and
Mhm.
get that doctor in front of our name. So even then, it's a reason they call it, are you a practicing clinician, because you practice. So
Absolutely.
understand that you're always learning. So that's really good.
Yeah, and I remember when I was applying to schools, one of the biggest things that they were saying, or asking rather, is, are you well, you have to be committed to learning.
Right.
Like, you have to be a kind of like a forever student.
Absolutely.
I feel like physical therapy, just in general, you are going to run across like some things that may not look the same
Yeah.
on the last patient that you saw that had maybe a similar like
Right.
background of origin of injury or anything like that. Just because any type of deviation could change the trajectory
Yeah.
of the plan or the intervention strategy, giving out to that next patient. So
Yeah.
if anything I've learned is like be open to just something else.
Yeah. Whatever. Because like you were just talking about, like you can go into a patient's room and the paperwork says one thing, but they present completely different. You might go into one room and they're really motivated, and then the next room they're not at all, but they have the
Mhm.
same kind of case. So that's very, very important to be mindful of when you do treat, because you don't know what you're gonna walk into. It
No,
just could
no.
be anything, honestly. So I appreciate them doing that for us. So
Yeah,
the lab has been great, being able to see that dynamic with the students and the professors. They've been really open and just honest with us about everything that we're going to see, and the information that they're providing. They're doing their best, and I feel like they are. I
yeah,
truly do. Yeah.
absolutely. I think this to me has been one of the most impactful labs,
Mhm.
just because it is a summation of everything that we've been learning outside our didactic work, and they're asking us type of questions where we have to pull from like way past like courses we already completed.
Yeah.
We're talking about, we have PT fundamentals where we're really learning, just being introduced to some type of strategies. Now
Yeah.
we have to understand how to alter like some of
Right.
those strategies in order to, better make better decisions to
Hmm.
help elicit like some type of movement pattern for the patient. I
Yeah.
thought it was really interesting today that
Yes.
we learn, how to what is it? Up with the good, down with the
Oh
bad.
yeah. And that can be played with a little bit, just depending
Yes.
on which stage the patient is in. Like if the patient is in like a recovery versus
Mhm,
compensation, they
mhm.
made that a big deal to understand the difference with the plan of care is, right? So I'm explaining this to you guys a little bit just because I want y'all to understand. So if you're in a recovery, then we're trying to get you back to where you're normal, where you were prior to your diagnosis. And then when you are inside of a compensation, we're trying to get you the best mobility and functional outcome you can due to your diagnosis. Okay.
Yeah, good
Yeah.
stuff.
Yeah.
Yeah, that's
Yeah.
some good stuff.
That's it right there.
Dr. Perry.
Very good. I got another question. We'll do two more questions.
Okay,
I get
two
all
more.
right. All right, fair. So the next question is, do you feel like the labs have helped you solidify the information we've gotten from the didactic work?
Yes, absolutely, I do. I feel like when we get asked questions now, in our lab immersion,
Hmm.
I'm able to respond relatively like quickly.
Yeah.
Or they might throw in a curveball and I'm like,
Right.
like let me break down like
Yeah.
this in a different way, or just like find another way to navigate the situation.
Hmm.
Like if we have like a hemiplegic,
Hmm.
and that's someone for the listeners out there, that's someone who has paralysis on one side of their body.
Yep.
If we have that going on, what depending on the level of the spinal cord injury, if we're talking about a spinal cord injury patient,
Hmm.
that may have that may that causes me to think of maybe they have issues like breathing.
Yeah.
Maybe they have different type of sensory proprioception type of issues as well.
Hmm.
It I feel like with all the didactic work that we have, I have a better viewpoint of the full picture of a patient and more than just what they're presenting, things
Yeah.
that are not translated via paper. But
Yes.
what about you?
I agree. I agree with that for sure. I feel like I agree on everything, but truly, I do agree. That's really good because they have solidified everything, and if they haven't, they will. I feel like they talk about a lot of the cases, and they tie them in. They give us the questions that allow us to really critically think, and a lot of times there's not just one answer. They're looking for you to be creative and give them feedback so they can think of it in a critical situation as well. So if you can give great rationale as to why you're doing it, then it can make sense. It doesn't. I would say as long as you have great rationale and it helps the patient reach their goals,
Hmm.
it's functional and it's
Absolutely.
safe, of course. So
Hmm. Now, mind you, listeners, there are wrong answers.
you can't just say something off the wall, man. Not saying that. Like I said, good rationale and safety, and it meets the patient's goals. You're good to go.
You're good to
You're good to go.
You're well on your way. Well on your way. And I think sometimes that could be the hardest part is understanding and taking consideration the patient's goals versus on how like you would want the patient to like proceed.
Absolutely.
Sometimes we will want to emphasize like, oh, like, we want to get this patient up and moving and walking, and the patient's goal, oh, walking to the point where we want them to be able to run. Like
Yeah.
maybe the patient goal is like, just I
Mhm. Right.
I just try to walk here.
Right. I'm just trying to go to the refrigerator. All right.
Like, I love your enthusiasm, but you need to calm it down. So sometimes it's taking the reins back a little bit and understanding like, hey, let me meet let me meet where the patient is at currently, and then
Absolutely.
we can work together in order to fulfill the goals that they want to achieve, not just,
What you want them to do. Yeah.
yeah, like,
Yeah.
no, that's not right.
Yeah. And that can be tough sometimes, because you have these goals for a patient, like, oh, you said that you used to be active, you were, I don't know, a track athlete like you, so you used to run, so really athletic, somebody who usually participates in sports and they're self motivated, but the patient's like, I just want to play with my grandkids. I don't have any desire to run.
Mm,
So what you want to do is just get them functional enough to be able to play with the grandkids and have a quality of life for the remainder of their life. It might not be a goal to run, so it's
right.
not realistic. So
Mm.
the goals have to be realistic.
Absolutely. I think one big thing that we're also learning and something that they're emphasizing is it's not just the impairment, it's definitely the environment that
Yes.
you have to pay attention to. So, for prospective students, and current students of programs, one of my biggest advices that I can give at this time, because I am learning too, is that remember the patient is so much more than just like what you see on the paper.
Right.
They have their whole environmental interaction, and y'all will understand, and be taught like the ICF model. And you should always keep that in the back of your mind so
Yeah.
you don't neglect just their environment, just their activity limitations, things that are personal for them, what they
Yeah.
want to achieve as well. All of those come into play when you're designing an intervention strategy.
Absolutely. And be mindful of their cognition. Like we were talking about, they may not be motivated. And then you want to get to the root of it. Like what's causing this, you not to be motivated, or, is your environment, are your family members not motivating you, or are they motivating you
Mhm.
to get back to, where you want to be? So
Yeah,
definitely
absolutely.
there. That's good. That's good stuff.
That's good stuff right there. Signed and approved.
All right, we'll do one more question for you guys. The next one is, what hands-on skills have you found challenging when we have met up for labs? And have you found any of them challenging?
Um, I mean, I I don't want to come off a type of
No, yeah.
I don't necessarily think it's been challenging. And I say that because the work has been put in order to learn these skills to first be introduced to them, to understand like what they would be used for in patient scenarios before I even start
Yeah,
doing any type of manipulating of whatever.
right.
Then once we get to our lab immersion, we dive right
Hmm.
into understanding cases, understanding what is going on with the patient, breaking it down to like there's no more.
Right.
Bring it down
They
that
do
case.
go deep in the cases. Like,
And then you get to you just have to be confident in the interventions that you think of, and the confidence comes from you having that rationale.
right.
So once you have the interventions like in your mind and you have the rationale and you understand anatomically how things work,
Yeah,
because anatomy is always going to be your best
right.
friend.
Always.
Then you can kind of piece together how like force manipulations start working and what needs to be moving at what time or
Yeah.
when I need to be blocking. Specifically, a skill that we currently are learning and have learned thus
Mhm.
far is just the manual facilitation of a hemiplegic patient,
Oh, yes.
or a patient that's using a walker.
Yeah.
Just being able to know that I need to block the
Yes.
knee, or if we're doing weight shifting balance, like having that appropriate distance, like
Hmm.
from the knee, to give them, the ability for their tibia to actually advance forward.
Yeah.
So, and these are gait specific type of tasks that I'm talking about. There's a couple of different stances, and sometimes when you are designing intervention strategies, you may want to look at specific phases of gait to work on instead of trying to work on the entire gait cycle.
Yeah.
Sometimes that's just not appropriate
Right.
based on the level the patient presents at.
Yeah.
But
Definitely.
yeah, and that was a mouthful, but
Hey, you explained it very well. I'll say, has there been any challenges? Manual, I would say no real challenges. I would just say just being able to proper hand placement and practice, being able to do that over these past, couple weeks in the whole entire program, honestly, just being able to put hands on people and practice more, just getting more comfortable with those skills. That's been probably the biggest challenge for me, because we go through life and we don't just have a patient with us all the time,
right.
and if you do, people have lives too. So being able to just practice that, and then when we get in the lab, just being able to apply it. Also being mindful, like you were talking about, having that progression, like understanding where the patient is, meeting them where they are, and trying to get them to where their goal is. You got to figure out like what's the limitation in order to progress them as well. Like you're talking about with the hip, like initiation of like walking and things of that nature. You might want them to walk, but they're unable to even roll in bed. So you'll start out with small tasks, like such as rolling, initiation of rolling, and you'll break it down. You'll start with them reaching and then trying to force their hip, to one side, and then it'll just continuously go from there. And at the end of it, you want them to be able to walk and then eventually play with their grandkids and things of that nature.
Yeah.
So just getting them back to those functional activities and allowing them to understand that it is a process, and there is times that you may be discouraged because everybody's time frame is different. So they might have a different prognosis than the next patient who might progress slower or faster. So they just got to be mindful that staying the course, just
Hmm.
being mindful that we are doctors of physical therapy, and there is time. There is nothing is perfect. So they just have to stay the course and trust us as therapists to guide them in the right direction to be where they want to be and meet their goals.
Yeah,
So
and
for sure.
I love that. Yes, when you're talking about creating that sense of trust between you and the patient, I feel like one of the foundations of that is being realistic
Yes,
about their prognosis. And that's also sometimes a difficult type of conversation to have.
absolutely.
Some people may not be ready to hear that type of just information. However, it's very pivotal and very important that we deliver it in a very tactful way,
Right,
just because we do want to make sure that we are working in an air of realism.
right.
If Unfortunately, if you are not going to be able to walk because of some type of injury on a spinal cord level, then
Yeah,
we need to tell you,
yeah,
so you're not sitting there in limbo and you're
yeah,
kind of like thinking like, I'm going to get this ability back.
yeah.
And we can shift that type of energy and focus on now, how do we
Right.
navigate this new
Yeah.
environment that we're in?
Yeah, let's talk about what you can do, you
Yes.
know. Um, that's a goal. You can tell them that that is a goal that we have for you.
Mhm.
But for now, we want to focus on this area right here where you're really good, so you can be able to do the next thing that you guarantee that they will be able to do next.
Yeah.
So I think that's awesome. That's awesome.
Yes.
And having those tough conversations is not easy. Not even with somebody who has full ability, it's not easy to tell them, hey, right now you're not going to be able to do this, but eventually that is something that we want to do. And just letting them know that you are there for them, and it's going to be a process. There's going to be highs and lows, but stay in the course. We'll be able to make it happen together. So,
Yes, yes. I think sometimes that's the hardest part because there's just certain situations where you're saying like you'll be having an increase in physical ability and
right?
then you'll hit maybe a little roadblock. And our responsibility and role as physical therapists is when we hit that roadblock and we know, based on the prognosis that you do have the ability to continue forward in increasing your physical activity level
Yeah.
or just your ability to move like limbs,
Hmm.
we have to be creative and find ways to challenge you and your body
Yeah.
in order to push past that so we can continue forward. But we need our patients to understand, you know, what we are actually like working towards, what
Right.
we're striving for on a realistic like
Yeah.
way. And
I'm with you.
and I'm gonna try my best
Yeah.
to
I'm with
find
you
that
there.
balance.
I'm with you there, and that's where I found my love for physical therapy, just the creativity of it, being able to be creative with all the interventions and just make it more functional in order for them to be back where they want to go, and also just a understanding of what's going on with each patient. So you're not really like we talked about. Anybody can walk in the door. You just have to, as a doctor of physical therapy, you got to be able to understand what's going on and then have realistic goals like we just talked about. So
Mhm.
that will make the patient more comfortable because they're like, oh, this physical therapist knows what they're talking about, and I trust them. You build that
Mhm.
relationship, and then they build confidence in themselves in order to want to do it. And they're telling their family when they leave you, they're like, hey, today I sat on the side of the bed. I know last time you
Mhm.
saw me, I couldn't get up, but we sat up for 2 minutes. Just
Mhm.
small goals like that keeps on encouraging them, and the family members like, wow, are you really? I want to come see you for the next treatment. So then
Mhm.
they get more support and people in their corner, and you're in the corner the whole time because you see them from the beginning and you see the vision, so they they have having somebody in your corner, and that's there for you, and every time you meet them it's positivity. So you're like, oh my goodness, this is something that's really gonna happen. this
Yes.
this guy wouldn't believe in me if they didn't know it was gonna happen. So having
Absolutely.
that is essential, I feel like.
Yeah, I feel like the patients having that, you're right, is completely essential. I also believe PT should have that source of support as well.
Yeah.
And I think one of the greatest forms of support that other doctors of physical therapy can have are mentors or people that they do,
Yeah.
can look up to or ask questions, just whether it's like career or even like, hey, I have patient A doing this.
Yeah. Yeah.
What is going on? Or hey, have you seen this before? Of
Yeah.
course, like are there any type of mentors that you um had the opportunity to like speak with before you got into the program, or any type of mentors that you found through the program that's just kind of like been in your corner, and how did they help if you
Yeah.
did?
So I already had a PTA degree before starting the program, so I got to work with a lot of really good PTs and PTAs and things of that nature. So being able to have them and then ask them questions while I was already treating was really good because they could give me rationale and then deeper learning during that time frame. I probably didn't understand it to the depth of their education, but it just kind of gave me like a rough understanding, and I was like, okay, so this is what connects to this and things
Mhm.
like that. So that really helped. And then also, it made me fall in love with all of the fields. I really didn't have a specific setting. I was like, or direction I wanted to go. I like neuro, I like ortho, I like sports, I like everything just because I felt like all of it has something I could take from it. But I know we talked about which ones we really liked, and the ones that I pulled from it the most were the sports and the ortho for me. But
Mhm.
it's changing. I feel like every day is like,
You
oh
don't want to
man,
be you don't want to be with the geriatrics no more.
I still love my old people. I still love my old people.
Sorry,
I
my
mean, my young people. So yes, definitely. I feel like all in the different settings, I'm open to them now. Versus I
okay.
was like, I don't want to do peds, I don't want to do this, but I'm open to it all just to see like the different walks of life, and you just get a more of appreciation, and then you just get to see different stuff. So,
Mhm.
and it makes it really fun. You really don't feel like you're working; you're just there to learn
Mhm.
and provide the information that you know. So,
That's amazing. That it really is, because your background is so unique, like already kind of like being within that field, that culture. So you got that exposure, and you were able to ask those probably deeper questions because of your own educational like background.
definitely
So
helped.
that that's pretty impressive. That's nice. That's not, I was a tech.
Text could ask too. Text could ask too.
Yeah, I was. I was. I remember the PT that I was working for. I asked him so many questions. I did, because at the time I just didn't understand anything.
Yeah.
I walked into a clinic, and I came from uh, like over a decade of just like being a personal trainer.
Hmm.
So my background definitely, like, yes, it can, those skill sets definitely can be utilized in this. I find myself still being able to pull from those experiences.
Uh-huh.
Um, but when it came to the information out of the surface level,
Right.
I didn't know. Besides my bachelor's degree,
Yeah. Yeah. Yeah.
I didn't know really quite anything. Um, so I mean, I give you all the praises. Yes, like, that's amazing that you even decided to, go from PTA to PT. Like,
Yeah.
that's a wealth of knowledge that you have, and the mentors that you were able to speak
I definitely will say help because I was a bachelor student just like you, and I was like, oh, I know exercise science, so I know what I can do. You, truthfully, you don't know anything. You know like rough stuff, but once you get into like the PT field, it's like, oh my goodness, I really didn't know anything. Like they go in very depth um with with any kind of physiology and just all of it. And it's just
with.
I can't explain how much it is. It's a lot of information. But once you understand it, everything will start to click, and you'll be much more comfortable with the information and being able to apply it to an actual person
Yeah.
versus just reading stuff on a textbook. So I think that really, really helped. And then also having the background with sports that helped as well, like being able to identify certain muscles, bones, that all kind of came together as well. Like we'd be calling this collarbone, but once you get into PT, it's like, oh, that's the clavicle.
Unacceptable.
But
You know what?
right. So when you're doing like documentation or speaking with another medical professional, you'll be able to tell them the clavicle was fractured. And then you speak to your patient, it'll be a different jargon. You won't want to speak to them in medical terms. You want to tell them, okay, your clavicle was fractured. They'll understand that. So just being able to have that jargon and just a different level of understanding will really help you out. Being able to know like medical terminology is really what it is.
Yeah.
That will take you a long way. And I know a lot of people want to just go straight into PT and becoming a DPT, but I'm one of the people that will encourage you to do a PTA just to see if the DPT is the level that you want to go. Because a PTA, you do a lot more treatments versus PTs and DPTs are more your evaluations, your recertifications, and your discharges and all that good stuff. But as a PTA, you get to see the backside of things. You get to see the plan of care, treat them out. You get to understand the rationale. You get to ask people that are DPTs, why are you doing this? I understand they have this weakness, but what exactly is going on? So I think that is really interesting. You also get to work hands-on with other medical professionals. Like I might get to work with a CODA, which is a certified occupational therapist assistant. Being able to work hands-on with them, seeing their profession, working along with ours, and how we can co-treat a patient, it can really help them progress as well, if it's necessary, of course. But being able to see that and just putting the functional task and life task together is really beneficial to the patient after all. And because on the PT and the OT level, they will be they'll do an evaluation, but they won't be treating the patients. And not all PTs or OTs don't treat. They usually do the evaluations and research and the discharges, but some do treat. Some do treat if it's necessary, of course.
We work as a doctor of physical therapist. We work in tandem with so many different fields. We love our PTAs. PTAs are a special part of a clinical setting because they are instrumental and vital in order to help out with patient care.
Yeah.
Absolutely, the value is tremendous. Our OTs, shout out to our OTs.
Absolutely.
Shout out to our speech pathologists as well.
That's right.
Like we work in tandem with so many different personnel from the medical team, and we have to keep that in mind when we are trying to communicate with them, that we have to be just as professional as they are. So that is the importance of understanding medical terminology, like you're saying, because that's how you're able to properly communicate with others. So I think getting in and getting the experience to get in those settings is the best thing that you can do. Just be surrounded. I know some programs like have their required hours. I would challenge people to get a little more.
Yeah.
Like if you want to be in it.
I would definitely encourage people to get whatever the minimum requirement is in each setting. And then if you're interested in one specific setting, try to do a couple more hours. It can only benefit you, and show that company or people that you're thinking of getting letters of recommendation from that you are serious about it and it's something that you're truly interested in. So I definitely encourage that to the highest for sure.
Well, today has been a great talk. It's been amazing being in the same room as
Same.
the man, the myth, the legend.
Same real. Don't let us say that.
Please send us more questions. Follow up with us. But if there's anything else, do you have anything else for us tonight?
I don't have anything else. But I do want to say, I want to finish. Thank y'all again for subscribing. Thank y'all for liking our videos, sharing our videos. We really appreciate you guys. Y'all have been our biggest support, and y'all keep us going, honestly. We enjoy just being able to have this conversation with each other and just showing y'all the brotherhood we've built from the profession that we look forward to going into and how much it's taught us. It's been a blessing for me. And I mean, I wouldn't rather be anywhere else, honestly. I really appreciate Aaron, and I'm happy that he's here, some of my classmates, and just being able to get this time So thank you guys again. If y'all have any other questions, again, as I always say, please continue to send us your questions, any kind of concerns, future questions. If you're thinking about anything else, then please let us know. It doesn't even have to be about PT or therapy in general. You just feel free to just reach out to us, and we'll get back to you as soon as possible, within means, of course, because we are students as well. So try to be mindful of that for us. So thank y'all. Thank y'all very much. We're
Yeah,
good.
we're good. We'll talk to y'all later. Take care.